My name is Matt Squires. I'm an orthopedic surgeon here at Scripps. I started practicing medicine in 2019. So I do hip and knee replacement surgery. That includes anterior hip replacements, partial knee replacements, full knee replacements. I use robotics and computer navigation as well as conventional approaches. I also do revision surgery for people that have hip and knee replacements that are worn out or infected or otherwise have failed. I became an orthopedic surgeon because, in my opinion, it's the specialty where you can help people go from a condition where they're debilitated and in pain to significantly better very quickly. It's extremely rewarding to see a patient that's debilitated, that is sometimes, unable to walk, and take them from that to functional in such a short amount of time, sometimes, within a day. When patients come to see me, they really get to participate in their care. I don't want them to feel like they're coming in for me to tell them what I'm gonna do. We're gonna decide together. They're gonna be educated, they're gonna be informed, they're gonna have the information that they need to make the decisions that are best for them. I think trust is a big part of it, and a doctor that's willing to listen and treat a patient as a patient and not just their next procedure or their next surgery. And building rapport, building trust with patients, I think is key. If a patient trusts their physician, they trust their surgeon, then you're able to engage in care and in conversation a little bit more, and have a better outcome and a better relationship going forward. Because what we do as surgeons is not just perform the surgery and have patients leave. We see patients for years and years, and sometimes operate on multiple joints, and we'll see them sometimes decades later. And so I think having trust in a relationship and just building good expectations from the beginning and having that moving forward is important. We have a great practice, and our orthopedic surgery practice within Scripps is an amazing group. Together with other physicians and other providers, we make sure that patients have all their global care, that they're optimized from a medical standpoint before they have surgery, and so that they can get connected with who they need to be connected with to be successful, not just from getting their hip or knee replaced, but as a person as a whole. Robotics, computer navigation, augmented reality, artificial intelligence is really becoming a huge part of what we do in planning for surgery and in executing the surgery. I think going forward, that's going to be an even bigger part of how we can perfect our craft. I became an orthopedic surgeon, honestly, because it's a lot of fun, and specifically a joint replacement surgeon because I have a lot of fun watching patients go from somewhere where they're in chronic pain and they've been suffering to a position where they're happy and smiling. Just the other day, I had a patient come into clinic who, before surgery, she could not even walk, and she came into clinic with a smile on her face, kind of waltzing in just a few weeks after surgery. And being able to see that in such a short amount of time is a lot of fun for me, and it's really rewarding and makes me love coming to work every day.